A little history of the program. The program started in 2004, graduated our first class in 2006. And we are very proud to boast that we have had 100% pass rates on our both our written national boards and our clinical boards ever since the beginning of the program. So we're really excited about that. Many of you may know that we used to live here on campus in a building just over there. But Hurricane Harvey changed that. We flooded out badly in Hurricane Harvey. So we are now in a leased facility down on Farm Road 1314 in Porter. But we have everything we need. We have 15 dental chairs there and a fully functioning clinic and classroom and lab, everything that we need. And we'll be staying there until a new healthcare building is built here on campus, which is expected to be finished summer of 2021. So those of you that would be applying to the program anytime soon, you would be with us down in our facility in Porter. What does a dental hygienist do? A dental hygienist evaluates the patient's health and their oral health, educates the patient on their oral health and how it relates to their general health. We expose radiographs or take x-rays. We do intraoral imaging, oral cancer screening. We clean the patient's teeth. That's the part you guys know mostly about. We also perform non-surgical periodontal therapy, which is for our patients with gum disease, and many, many other things. Our program is accredited by the Commission on Dental Accreditation. So this is very important because in order to get a license as a dental hygienist in the state of Texas, you must graduate from a CODA accredited program. You must also pass a written national board exam, which is a 9-hour written exam at the end of the program. And you must also pass a clinical board exam, which is a live patient exam. Every 7 years, the Commission on Dental Accreditation comes and does what's called a site visit with us. It's a very rigorous process. They want to make sure that we're meeting all of the educational standards that they have set forth for dental hygiene programs in the United States. Our next visit is going to be next year in 2020, and we have had glowing reports every time that we've had one of these visits. So we have maintained our accreditation. This is something that I want you guys to be aware of. I don't know if it affects anybody in the room, but at this time, the dental hygiene program is unable to accept international students with an F1 visa. This is due to our being located at a remote location that is not currently approved by the Department of Homeland Security. If you have further questions about that, there is an email there or a website that you can go to find out more. So a little bit about our program. We offer an Associate of Applied Science in Dental Hygiene. It is a 68 credit hour course that takes place over 5 semesters, 2 years or 5 semesters. It is a full-time daytime curriculum, so we cannot offer nighttime courses, we don't offer weekend courses. And the structure of the program is such that it's called a cohort program. So you start the program with a group of students, you take every single class together, and then you do all your clinicals together and you graduate together. So there's not an option of taking classes as you choose throughout the program. It's all set out for you from the beginning to the end. So in order to apply for 2020, you must have completed these prerequisite courses. So Introduction to Chemistry, which is Chemistry 1405, or Chemistry 1411, which is General Chemistry. Those have to be completed. It's a 4-hour course with a lab, very important. Some of the other community colleges in the area offer a 3-hour course without a lab, and we will not accept that. So be sure you've got the right one. English 1301, Sociology 1301, and Biology 2401, which is A&P 1. So these are absolute prerequisites. You must complete these by December 31st of this year in order to apply for next year. No exceptions, okay? Biology, we don't care how old courses are with the exception of your biology courses. So A&P 1 and 2 and micro have to have been taken within 5 years of the application. I'm not going to go over in detail how you would refresh those biology courses, but I do have a little handout here for you guys that you can come pick up at the end, and I'll be happy to talk to you about it. It's also all posted on the website. So for those of you watching online, that information is on the website. In addition to the prerequisite courses, there are some general education courses that are required for our program that we do recommend that you take before you apply to the program. Do you absolutely have to take them before you apply? No. Is it likely that you'll get accepted into the program without them? No. So we do recommend that you take them ahead of time, and we give you points on your score sheet if you do take these ahead of time. 2 reasons for this. One is that you get them out of the way. Our program is very tough, it's rigorous, and you don't want to be taking micro and A&P2 while you're also taking radiology and histology and embryology and all sorts of other ologies. So it's really a good idea to get them out of the way. The other thing is you get more points on your score sheet. So you want to be competitive in your application. We get asked, how many applicants do you have? Every year we have 150, 170 qualified applicants, maybe over 200 applications, but 170 say qualified for 15 spots. So it is very competitive. So having taken these before you apply will give you a leg up. In addition to taking the prerequisites and the co-requisites, you do need to have observation hours in a dental office, observing a dental hygienist. So this is not observing the dentist, not observing the assistant or the front office, but the dental hygienist. And you're required for this year to observe for 20 hours. Some of you may have already done this in the past because we've required 40 hours. We've made that just 20 hours now, and the hours that you have are valid for up to 3 years. So if you've done the 40 hours in the past, you're good to go as long as it was within the last 3 years. Now, I do want to stress a couple of things. You cannot do this in the office where you currently work. If you work for a company that has multiple offices, you can observe at another location, just not in the location where you work. It is very important, and this is for Deidre, really. We look at all of this. So, over 200 applications that we had last spring, we looked at all the observation hours, and if they weren't completed correctly, everybody got a little email from Deidre to fix it. So make sure every time you go to an office, you have the number of hours that you completed that day with a signature for that day. You can print up as many of these forms as you need, but don't just put 20 hours and then a signature, because we will be contacting you and you'll have to go back to the office and get that fixed. Our application is completely online. It will open in January. There's an online application, a very short little 1-page application, just name, address, phone number, all that kind of stuff. And you have to have completed your observation hours before you can submit your application. And it's totally online. One thing that you need to remember is that in order for the courses that you've taken to be considered on the application, we have to have official transcripts from all of your colleges or universities that you've ever attended. If you are not currently a student at Lone Star College, if you're interested, if you're serious about applying to our program, just go ahead now and apply to Lone Star College, get a student ID number, have every transcript from every college that you've ever attended sent in for evaluation. Just do that now. If you're taking classes this summer or this fall that are going to be transferring in, as soon as grades are posted, request another transcript to be sent over if you're not at Lone Star. If you're at Lone Star, you don't have to worry about it. Everything's already here. But that is really important because it takes 2 to 3 weeks to process these transcripts. And if you wait until January when you're about to do your application, or February when you're about to do your application, you might miss the deadline because those transcripts are not evaluated. So we don't want any of you to be in that situation. We don't communicate with you by any way except for your Lone Star, my Lone Star email. So, and in fact, if you try to send us something through your personal email, it will likely go into a spam folder and we won't get it, or we may not get it. And we communicate with you only with your My Lone Star email. So that's really important to check that, to make sure that you don't let your password expire and you know how to get in there. Math. This always comes up. Do we require math as a prerequisite course? We do not. But we do require that you are ready for college math. So there are a couple of ways you can show evidence of that. When you enter the college, if you're entering as a brand new student, you will take the TSI assessment, and we require that you achieve a score of 350 or better to be exempt in our math for our application at Dental Hygiene. The other way you can show evidence of this is to take either Math 0309 or 0310, or clearly if you've taken college math and gotten a C or better, then you are also qualified in this area. Of course, you must, in all the prerequisites and co-requisites, you must have a C or better for those courses to count. Okay. The final requirement for our application is that everybody take the health science reasoning test. It's different from any test you've ever taken. It's not like the SAT or the ACT or TAKS or anything like that. We're not testing your knowledge of science or math or English or reading comprehension, but this test measures your ability to reason or to think critically. It is a 33-item test that is timed. You have 50 minutes to complete it. We offer it here on the Kingwood campus. Is the only place that you can take it, in our testing center. And you may only take it during the application period, and you may only take it once per application. We take the score from, if you've taken it in multiple years, we accept only the score for the current year. So it's not something that you can really study for. I always say there's good news and bad news with this test. The good news is you don't have to study for it. The bad news is you can't really study for it. So there is an app for those of you that you want to have some idea about this test. There's an app in the App Store that's called Critical Thinking Insight. And they have a short practice test. This is by the company that does the health science reasoning test. And they do have a short little timed practice test to kind of give you an idea of what it might be like. I think my advice for you taking that test, watch your time because it is timed. So don't spend too long on any one question. And also don't rush through it because they do require some thought. So, take it at a time of day when your brain is awake, and make sure you've had some good brain food and a good night's sleep. That would be my best advice.
Where do we go to sign up for that test?
So you don't need to sign up. You just go to the testing center. You'll need to actually go to the cashier's office in the SCC, the Student Conference Center, and pay for it. It's $15. And then you can go right up to the testing center. The testing center hours are posted on the website. They do ask that you be there 2 hours before the testing center closes in case there is a queue and you have to wait. Thank you for that question. Yeah, and it's only offered at Kingwood. Yes, sir.
You said once per application period?
Yes, you may only take the test once per application period.
So does that need to be taken before the application period?
No, the test is not even available until the application opens. So you need to take it, it will open the day the application opens, but it does close 5 days before the application closes because we need time to get the scores and input those scores onto your score sheet. Here's our dates. Every year it's the third Wednesday in January to the first Wednesday in March. This is what everybody always wants to know. Okay, so how do you choose who gets in? So we have a very objective process, and we have a score sheet. And we have a score sheet that is in your packet. It's in the back of your packet. So there are 3 sections on the score sheet, and we'll kind of look at this so you can kind of figure out where you would be. The first section is prerequisite GPA. So it's simply the GPA of those 4 prerequisite courses. So the possible points would be 4. If you had all A's in all of those courses, you would have a 4.0 or 4 points in that category. If you had, some B's or whatever, you could have like a 3.75. That's what would go in the total score there for you. The second category is for the grades on your general education courses. You get 4 points for every A, 3 points for every B, 2 points for every C. If you have not taken the course, you'll get 0 points. So you just add all of that up. And then you look, there's a range there. So if you, in that category, if you had 17 to 20 points, you would get 4 points in that total official score category. 12 to 16, you would get 3, and so on. So the last category is your health science reasoning test. You may remember I said that it's a 33 item test. So the highest possible score is a 33. So if you had between a 29 and a 33, you would get 4 points. Between 25 and 28, you would get 3. 20 to 24 is 2, and so on. Below 15 points, you would get 0. So then we just look at that last column there, add it all up, and that is your score sheet score out of 12. 12 would be perfect. Does everybody get 12? No. Does anybody get 12? Pretty much no, okay? So even though it's very competitive, you do not have to have all A's and you don't have to have a perfect score on the HSRT to get accepted. I always like to compare. So this year, the lowest score for our accepted class was 9.47. The previous year, it was 9.17, I believe. The year before that, it was 10.1. So it varies, some depending on who else is applying. So how strong the applicant pool is pretty much, who else is in there with you is going to depend on how high those scores are. So no, you don't need to have a 12, but you want to have as high as you can. We often get asked, if I haven't taken all those courses, should I apply anyway? I say yes. You have nothing to lose. Take that health science reasoning test, kind of get your feet wet. You'll understand the process, and then if you're not competitive, you certainly have the opportunity to apply again. We get asked about repeated courses. Clearly you want to have as high a GPA as possible, right? So some of our applicants will retake courses over and over and over to make A's. So this is not necessarily a good idea. We actually will penalize you if you take a course more than twice. We understand you take a course, life gets in the way, and you do poorly for a semester. We get that. So you retake, you make an A, all is well. But if you have to take a course 3 or 4 or 5 times to make a good grade, you're probably not a good candidate for our program. Once you're in our program, every course has to be passed with a 75% or better, or you're dismissed from the program. There's no opportunity to retake courses. There's no opportunity to drop a course and take it next semester because of the cohort structure like I talked about. So that's why we penalize you for, we're not trying to be mean. We just know that if you are not able to be successful in 2 attempts, certainly, you're probably not a good candidate for our program. So any questions about that? Yes, sir.
Does that go for only the prerequisite and the co-requisite?
It does. That only goes for the prerequisite and co-requisite. If you took economics 5 times, I don't really care. So, yeah. Yes, ma'am.
But that goes for the refresher,
Thank you for asking that. The question was, does that also go for the refresher course? No. If you have to take the refresher, you're not penalized because that's not your fault, if you will. And we already talked about the repeated courses, but this is something that definitely we need to have on your radar screen. And the system will be set up that it will automatically deduct those points from your score sheet. So what happens next? We have all these applicants and we have their scores. They're ranked in a spreadsheet, and the top 24 applicants are invited for an interview. That also will include anybody that's tied at that 24 spot, because the numbers get really, really close there, right up at the top of the spreadsheet. So anybody that's tied at the 24 spot would be invited for an interview. We have the interviews, and then after that, the top 15 applicants will be invited to join the class. The question was, what do we look for in an interview? We look for somebody who is well-rounded, who can communicate well. There are, various, we look for a professional manner, which would include, by the way, professional dress. I just want to throw that in there. And if you don't know what that is, we have a wonderful career and counseling center here that can help you know how to dress. They have, they'll do mock interviews. These are mainly for employment, but it also translates, I think, for an interview like we would have. Thank you for that question. One thing I do want to bring up, this is something that is important. If there is anything in your background that could prohibit you from getting a license in the state of Texas as a dental hygienist, in other words, if there would be any sort of a hit on your background check, I would recommend that you contact the Texas State Board of Dental Examiners to determine if you would be eligible for a license in Texas. They have a form that they have you fill out. You pay them $25, and they will process something that says at this date, you are or you would not be eligible for a license. Their background check is even more rigorous than the college has. So just because you pass the college background check does not necessarily mean that you would pass the state board background check. So that's why I send everybody to them, because I'm not going to say one way or the other. That's not my place. Immunizations. We do not require proof of immunization for your application, okay? So don't try to send us your immunization records when you're applying. But if you're accepted into the program, we will require proof of these immunizations. There's one that I do want to talk about right now, and that's the hepatitis B. And the only reason I'm mentioning it is because it's a series of 3 vaccines that takes 7 months to complete. So let's say you're accepted into the program next April. That's generally when we accept our classes. And school starts in August. So that gives you 4 months. You don't have time to complete that 7-month series. So I would say any of you that are seriously interested in a dental hygiene program or any kind of a healthcare program, just go ahead and get that hepatitis B series if you have not done so already. And that way you would be ready to enter the program. I want to inform you that as a dental hygienist or dental hygiene student, you will come into contact with bodily fluids, blood, saliva. And the Lone Star College-Kingwood has a very detailed policy on how we deal with bloodborne pathogens. The policy is on the website at that link. We do follow all of the CDC guidelines. We're pretty much infection control Nazis. So we follow the guidelines very, very carefully to protect both our students and our patients. This is always a big one. How much does it cost, right? So we are one of the most economical programs in the state, if not the most economical program in the state. Some of the programs are a lot more expensive. We're very aware that you guys are students and we need to keep costs down, but we also want to make sure that you have everything that you need. So students, on top of tuition and fees, you also will be responsible for purchasing your instruments, certain supplies. We have the board exams are pricey. So I've done up a spreadsheet that has everything on it from tuition and fees to your shoes, pretty much. And the total comes to just under $14,000 for the 2 years. So it's very important that you do budget and be prepared and don't just think, oh, I'll find it somewhere, because once you're in the program, it's difficult to work because it's like a full-time job. So, try to get all of your ducks in a row before you start the program. I can't emphasize that enough. And another thing too, for those of you that already have an associate degree or a bachelor's degree, the availability of financial aid is very limited for you through the college. So I just have to mention that. Yes?
Do you all accept the military benefits?
So the question is, do we accept military benefits? Yes, almost every year we have students that are using their VA benefits. Another question? Yes?
What time is the program like?
The program is 8 to 5, Monday through Friday. Mm-hmm. Yeah, so when I say full-time, daytime, I mean it.
Are there any clinicals on the weekend?
No clinicals on the weekend. Yes, thank you for asking.
So we have to buy our own uniforms?
Yes. We have a set color and what have you that you have to have, but you do purchase your own scrubs. And we wear scrubs every day, all day. You know, we don't wear regular clothes ever. Yes.
What about the loops?
Loops are also included in this price, and they are mandatory. Any other questions about cost? And I'm happy to share my spreadsheet with anybody if you just email me. That really breaks it all down for you. So, patients for clinical experiences. We have our 15-chair dental clinic right there in Porter. We are required to have all of our clinicals on site, as opposed to like nursing that goes to hospitals and different facilities. So the main part of our clinical education happens in our clinic. And students are required to bring in their own patients, although we do have a mechanism for screening community patients. And so patients from the community come in, they get screened, they get assigned to students based on what the student needs for their requirements. But you can't count on us giving you everything that you need for your clinical requirements. So just know that you're going to want to bring in your friends and your family. We say the barista at Starbucks, anybody that you can persuade to come in to be your patient. We do some outside rotations. We attend the Interfaith Community Clinic in the Woodlands. Our students rotate through there. We rotate through the Harris County Health Department's pediatric clinic here in Humble. But the bulk of our clinical education happens right in our building. That's me, that's Deidre, and the other contact that I want you to have handy is Dr. Sue Ann Herford. She is the academic counselor and advisor for the healthcare division here at Lone Star College-Kingwood. And, you know, advisors have lots and lots of students with lots and lots of different programs, and they can't possibly know everything about every program, but Dr. Herford knows everything about our program. So I would recommend, if you are going to see an academic advisor, make an appointment with Dr. Herford. She only takes appointments by email. She won't even talk to you until you are a fully enrolled student at Lone Star and all of your transcripts are evaluated. I was glad to see a lot of hands go up, those of you that already have an associate's degree, because we have an exciting opportunity here at Lone Star College-Kingwood, and it's very unique for a community college dental hygiene program. We have a partnership with Texas Woman's University in Denton, and we are able to offer our students the opportunity to complete their Associate of Applied Science here at Lone Star, while also working on their bachelor's degree in dental hygiene with Texas Woman's University. So what does that look like? First of all, you have to be accepted into the program here at Lone Star College-Kingwood. That's number one. After that, you have to meet the prerequisites for the TWU program. So that requires that you are core complete. So those of you with an associate's degree, you would be core complete here at Lone Star College-Kingwood. And there are some additional prerequisites that they require. One is Math 1342, which is statistics. And the other is, well, there's actually two others. English 1302, which you've probably had if you've already gotten your associates, and Government 2305, which includes that's US government. So you have to have completed all of that and be core complete or nearly core complete, because if you're just lacking, say, a humanities or fine arts credit or something, you could actually finish that while you were with us. The whole program is going to look like 120 hours, the last, or 30 hours at least, at Texas Woman's University. And they will transfer up to 90 hours from Lone Star, which is awesome, because without this agreement, if you decided to pursue a bachelor's degree after an Associate of Applied Science, you would generally need 60 hours at a university to complete that bachelor's degree. So you've already got your 68 hours with us. You may have had 20 or 30 hours before that working on something else. So, you know, it's like you're a full-time student forever. So this is really a great opportunity. Why do you want a bachelor's degree? That question always comes up, and it's a very good question. So if you want to work clinical hygiene at a local clinic for your whole career, You don't really need a bachelor's degree. You might want it for your own edification. But if you want to go into education, research, sales, management, various different roles that a dental hygienist can have, then the bachelor's degree would be preferred or necessary. Yes?
When would you need to decide to apply for their program?
So once you're accepted with us, I will look to see who might be eligible, and I'll reach out to you to see if you're interested, and then there's paperwork to do with TWU and a small fee to pay them for an application fee and that sort of thing. But really there's nothing you need to worry about ahead of time except completing those prerequisites. But the good news about that is those do not have to be completed by December 31st. You can continue working on those while you're waiting for your application and waiting to see if you're accepted. So it's a really great opportunity. The people at TWU, they're wonderful partners. They're very, very student focused. And you have the opportunity to finish that bachelor's at the same time as your associates. But if you find that it's just too much taking that many courses, you can stretch it out, and you might finish the TWU program a semester or 2 or 3 after you've finished our program, and they're very amenable to letting that work. We just had 4 students graduate with their bachelor's. They graduated last Sunday, actually, from the TWU program. So it's very doable. It's a lot of work. The work that you do with TWU is completely online because clearly you're not driving to Denton every week, but it's completely online for those courses. And let's look at the curriculum, what it might look like. These are the courses that you would take at TWU. So it's like advanced dental hygiene sorts of courses. No hands-on clinical, of course, because you're not with them face to face. But it's a pretty interesting curriculum. Lots of reading, lots of writing, but it's a really great program. You may know that attending one of these information sessions, either online or in person, is required, and so there will be, when you go to the application process, there will be a form that you have to fill out to verify that you've done the info session, and you'll need this code.